Assalamu alaikum. Welcome to the second part of cutaneous vasculitis, and today we will start the notes about small vessel vasculitis. Small vessel vasculitis is subclassified into either ANCA-associated vasculitis or immune complex-associated vasculitis. The ANCA-associated vasculitis include three diseases: the microscopic polyangitis, granulomatosis with polyangitis, and eosinophilic granulomatosis with polyangitis. The term ANCA refers to the presence of anti-neutrophil cytoplasmic antibodies, which are mostly of the IgG type. These antibodies target the proteinase 3 inside the neutrophil cytoplasm, and here they are called ANCA-C or anti-PR3 ANCA. Or they may also target the myeloperoxidase around the nucleus. And when it targets the MPO, they are known as P-ANCA or anti-MPO ANCA. Both ANCAs are capable of activating the neutrophils with consequent complement activation and eventual tissue damage. These ANCA-associated vasculitis affect small vessels mainly and affect the skin either as a part of a systemic vasculitis or as a skin-limited variant of a systemic vasculitis. Till now, there is no known single organ vasculitis of the skin with ANCA-associated vasculitis. The cutaneous manifestations of the ANCA-associated vasculitis are really heterogeneous. When the damage is in the form leukocytoclastic vasculitis of the venules and small arterioles, we find the classic palpable purpura, erythematous macules, and nodular lesions. When the vasculitis reaches small arteries, we find the retiform purpura and digital infarcts. In the two forms of granulomatous polyangiitis, there is non-vasculitic lesions, either granulomatous or even non-granulomatous lesions. Non-granulomatous, like the mucocutaneous lesions, hyperplastic gingivitis, especially in granulomatosis with polyangiitis. The three types of ANCA-associated vasculitis are the microscopic polyangiitis, granulomatosis with polyangiitis, and eosinophilic granulomatosis with polyangiitis. These three types of ANCA-associated vasculitis share the fact that they are all necrotizing vasculitis and they show a leukocytoclastic type of vasculitis. But GPA and eGPA additionally show granuloma formation with abundance of eosinophils in eosinophilic granulomatosis. In the first type, the microscopic polyangiitis, this is a post-immune necrotizing, small and even may affect sometimes medium vessels, mainly involving the lungs and the kidney. However, sometimes we can find cutaneous lesions, mainly in the form of palpable purpura of the lower limbs. Sometimes we can see livido, and on rare occasions, we see nodules and ulcers. However, there have been several reports of various skin lesions, including even erythema elevatum diutinum. The second type, which is granulomatosis with polyangiitis, formerly known as Wegner's granulomatosis, we have respiratory tract affection, glomerulonephritis, and we have commonly red friable gingiva, or what we call the strawberry gingiva, and we also have several other cutaneous lesions, including the classic palpable purpura, some oral ulcers, nodules, and even pyoderma ganginosa-like lesions. In patients with GPA, the ESR is usually elevated, and there is leukocytosis, and the C-ANCA is usually positive. Its counterpart, the eosinophilic granulomatosis polyangiitis, formerly known as Chrug-Strauss disease, has a marked affection of the lung with severe asthma and allergic rhinitis, one of the hallmarks of eGPA. It also affects the GIT, the peripheral nerves, and sometimes the heart. Cutaneous lesions include palpable purpura, petechiae, hemorrhagic bulli, nodules, livido, as well as erythema multiforme-like lesions. And actually, both these types of granulomatous polyangiitis may show non-specific rashes over the skin. The IgE is elevated in patients with eGPA, and the P-ANCA is also elevated in most cases. As you can see here, this is what is known as strawberry gingivitis, which is an important finding in GPA, and the palpable purpura that we see in both GPA and eGPA. As we mentioned earlier, ANCA-associated vasculitis of the skin is usually a part of a systemic vasculitis. In Wegner's granulomatosis, we have eye, lung, kidney, nose, heart, and then skin affection, while in Chrug-Strauss or eGPA, we have a classic triad, which is asthma, eosinophilia, and vasculitis affecting other organs, including the skin. Thank you very much. Next time, we will discuss the immune complex small vessel vasculitis.